Sir, can you please comment on the seriousness of the present pandemic situation with respect to the infection fatality rate with respect to other major public health burdens of our country?
Exactly. This infection fatality rate in the Western countries also, it was highly exaggerated in the beginning. And in the first 3-4 months of the pandemic, even a paper in Lancet said the infection fatality rate of COVID may be as high as 20%. It's a published paper. Because actually, the infection fatality is calculated by the number of people infected and out of them, how many died. Numerator is the number of deaths divided by number of people infected. That shows the fatality. So initially, Italy, particularly when it hit Italy, it hit the nursing homes, the elderly population, and the average age, median age of people who died in Italy was 80 years. So you can imagine 80 years people, any infection, a common cold kills 8%. So that denominator was the hospital cases, or they did not do any community survey how many had got subclinical infection. So initially fatality rate was very 5%, 10%, right up to 20%. Then most of the initial models were made on those figures. Then subsequently it was John Ioannidis from Stanford University and Jay Bhattacharya from Stanford University. They did some sero surveys in California, Santa Clara, and even in a small sample, they found a large number, 30-40 times having subclinical infection without knowing. So that brought down the infection fatality rate to almost 0.3%, 0.33%. And then subsequently, John Ioannidis he did a meta-analysis, and in the WHO journal also, it has been now accepted as 0.27 or 0.3%. And in fact, that is for the countries, particularly developed countries where they have a higher age and they have got a little more obesity. Obesity also is coming out as a major risk factor. We did a study in our field corporation just after the first wave. We found a seroprevalence of 35% at the first wave. And from that number of deaths and all that, we calculated our infection fatality rate at 0.17 and subsequently 0.07, 0.1. So in Indian population, younger population, it was 0.1 to 0.3, 0.5 is the global infection fatality rate. That is taking all the infections. Like if you say 70% after the first wave, 67% of the people got antibodies, that comes to 90 crores Indians were infected, 90 crores. And the mortality was just 3-4 lakhs that time. That gives the infection fatality rate of 0.05%. You see, 90 crores, even the global data set doesn't show 90 crores. As on today, 56 or 57 crores people are infected globally. But in India itself, there are 90 crores people who are already infected. They don't know about it. So that is the futility of just doing contact tracing and all. They are only helpful in the initial stages when you try to stem it in the bud. But once it spreads, then you just can't run after a disease which is very mild, which is mostly asymptomatic. You have waste of resources and unnecessarily creating panic. And compared to other diseases, yes, as you said, that's a very important question, particularly in our country. Like we can say in our country, it may be 0.1% infection fatality rate, and that is also across all ages. In the child, just one child or two child in 1 million infected child will die of COVID, and that 1 or 2 child also will be having some comorbidity. So infection fatality in the child is almost zero for a healthy child. It is survival is 99.9973 in a below 18 years old. Up to 69 years of age, the survival from COVID infection is 99.5. 99.5. 0.5% is the mortality in a 69-year-old. And in a young person, it is 0.0001 or something like that. Whereas for other diseases, like tuberculosis kills every day 1,400. Every day we are losing more than 2,000 children, different preventable diseases. 2,000 children are dying every year. Now 20 cases of COVID, we are getting death, and that too with comorbidity. 2,000 children are dying, we are not bothered. We are bothered of not a single child is dying of COVID. We are bothered that we will save the child from COVID. So you see, it is not only public health is about money also, resources also. It is balancing of health priorities. We are having children dying. Now the UNICEF says because of this lockdown and this malnutrition will increase, about 4,000 children will die daily in India, poor children. So, and children are dying now of other obesity and other things. In middle class children, they have found obesity has increased during the lockdown period. Sedentary habits have increased. So this will be killers in the long run. So these are the major burdens, and for that we have not got very accurate data as for COVID, which has got a mortality rate almost negligible. Particularly, we have got other communicable disease, not a single communicable disease has got lower mortality than COVID. Dengue we have got. I was seeing dengue for the past 5 months, they have not updated the data in the Ministry of Health and Family Welfare, which is dengue is a major killer in India. The data is not up to date. And here we are, every 24 hours, we are having COVID update. So this is something which is not stands to logic, common sense or science.